Assalamualaikum, I'm Dr. Anam Rao. Today the topic of my presentation is role of vitamin D in calcium absorption. To understand the role of vitamin D in the calcium homeostasis, we must understand the activation and production of vitamin D in our body. We should all remember vitamin D is not a vitamin, it is a hormone. Sunlight is a major source, and our skin is a major source of vitamin D production. When the sunlight falls on our skin converts 7-hydroxycholesterol in cholecalciferol. Our liver play a major role in conversion of cholecalciferol in 25-hydroxycholecalciferol. Now, the kidneys are the major sources of activation of vitamin D. Our kidneys convert 25-hydroxycholecalciferol into 125-hydroxycholecalciferol. You should remember our skin produces vitamin D, but that vitamin D is not in the activated form. Our kidney produce vitamin D in the activated form. So, the kidney disease patient have the lack of vitamin D because their kidneys are unable to convert the inactive vitamin D into activated vitamin D. So now the vitamin is produced from our skin and activated from our kidney. Now the function of vitamin D are number one and the most important, healthy bones. Vitamin D keeps our bone healthy by absorption of calcium from the intestine and keeping the adequate blood levels of calcium and phosphorus, which are necessary for our healthy bone and bone mineralization. Number two, vitamin D helps in maintaining the immune function. The adequate intake of vitamin D may help in support good immune function and reduce the risk of autoimmune diseases. The other function of vitamin D are keeping our muscles healthy, contracted, keeping our nerves intact, which carry the signal from brain to the body. So, vitamin D deficiency causes osteoporosis, which is the demineralization of bones, multiple bone fractures. If the vitamin D deficiency occurs in children, it is called rickets. Number two, fatigability. If you have deficiency of vitamin D, you may feel tiredness, dark scaly skin, loss of appetite, and lethargy. Number three, muscle strength. Vitamin D deficiency causes loss of muscle strength. Number four, you may face low mood swings, insomnia, and vitamin D deficiency. Now, the major concept to understand is how vitamin D helps in the absorption of calcium, or how vitamin D and calcium are interrelatable. Vitamin D in calcium homeostasis means vitamin D helps in maintaining the calcium level in our blood. How? When we have low calcium level in our blood due to any dietary intake deficiency or any kidney diseases or any other cause, low calcium level activates parathyroid gland. Parathyroid glands goes to the calcitonin from the thyroid gland and reduce the calcium absorption and increase the calcium excretion that may cause kidney stones. Now, who needs a vitamin D and calcium supplementations? General recommendations are premenopausal women aged between 13 to 45 years old should take at least 1000 mg of calcium, while postmenopausal women should take 1200 mg, including their diet and supplements. You should not exceed more than 2000 mg of calcium per day. So if you are taking a diet which is comprises on vegetables or dairy products or any other fat, protein which do not contain calcium 1000 mg in a day, then you should need calcium supplementation in your diet. Otherwise, if you are taking a healthy diet, you don't need all these supplements. But postmenopausal women should consider supplements of calcium along with a proper diet. Healthy adults who may need supplements. Vitamin D deficiency is very common in the world. Without sufficient vitamin D, remember calcium will not be absorbed and benefit your body. You are taking calcium supplements without vitamin D, it will excrete out in your urine or may cause renal stone. So, which adult should take supplements? Number 1. Adults with intestinal problems like lactose intolerance, celiac or Crohn's disease do not absorb many nutrients including calcium. They should take calcium supplements. Women who have premature menopause will experience bone loss and need to be vigilant about their diets. Those people who only eat vegetables and do not take any dairy products like yogurt, cheese, milk, they need calcium and vitamin D supplementation. Adults over age 45 who have had a broken bone from a low impact fall or injury should take vitamin D and calcium supplements. Adults who have been diagnosed with osteoporosis or low bone density should consult their doctor for the proper doses of vitamin D and calcium. Now, what you can do to monitor your vitamin D and calcium diet. Know your recommended dietary amount. Take a careful look at your diet for a few days along your food sources of calcium. Always see what you eat. See what nutrients you are taking from your diet. It is not difficult to find the RDA charts from Google, from internet. Always count your calories, count your nutrients, count your vitamins. Are you taking the proper vitamins from your food or you need a vitamin supplements? If you are a woman aged more than 50 or a man aged more than 70, you need an additional serving of calcium food or a day or may need to consider a calcium supplements with vitamin D. Adults who not live in their own homes, for example those who are in assisted care facilities, may need supplementation with calcium and vitamin D. It is an additional slide. You can have a look. Vitamin C and vitamin D rich diets. It is not difficult to find the charts or the diets rich in vitamin D and calcium. These are easily available on Google with authentic sources. Low level of calcium can cause extreme fatigue. Maybe you feel low energy, overall feeling of sluggishness. It can also lead to insomnia, fatigue associated with calcium deficiency. Can also involve lightheadedness, dizziness, brain fog. lethargy, bone fractures, any elder person in your family, always consider vitamin D deficiency and calcium deficiency first. Consult your doctor for proper supplementation and diet recommendation. If you have any queries, please you can write me on email address given at your screen. Thank you for your time.